Intro. In December 2025, the British Medical Association announced a fresh round of strikes in England after 3 years of deadlocked negotiations. Behind the repeated walkouts lie years of pay erosion, rising workloads, and a shortage of training positions that leave many doctors feeling undervalued and overstretched. These strikes are expected to cause significant disruption across hospitals, affecting routine appointments, increasing wait times, elective surgeries, and outpatient services. This situation raises the question, should doctors be allowed to strike during times of NHS crisis?
Hello, I'm Despina, and I'm going to be talking about arguments for allowing strikes. So, firstly, it's important to note that doctors have a legal right to strike, and that is protected under the employment law and European Convention of Human Rights, especially in Article 11, where it talks about how it's necessary to seek national security of public safety, and even talks about the protection of health, which I'll talk about in a minute, and how strikes link into that element. Please, can you move on to the next slide? Thank you. So doctors strike to highlight the severe staffing shortages. There are currently more than 47,000 unfilled nursing roles alone, which is quite horrifying. And they also want to bring awareness to the poor pay and poor working conditions. Normally, when people think of doctors, they think of a rich lifestyle. So it's important to show that that's not the reality, and it's actually quite horrifying to what people expect. This poor working conditions also lead to burnout, and that impacts the patient's quality of treatment, which is obviously quite detrimental to not only the patient but also the NHS's reputation. And that means that less people are likely to trust the healthcare system. And by striking, doctors want to promote a more sustainable work life, which is essential for safe patient care. And when considering why people want to go into medicine or like become a doctor, it all roots in this strive and aspiration to help people, which is in fact one of the four pillars of the NHS, beneficence. And it's the idea that of having the patient's best interest. This serves exemplary to why doctors should be allowed to strike. And also, my next point is considering that question of, is medicine as rewarding as expected to be? Medicine is a long journey from 5 years of med school and also 2 foundation years, plus the competitiveness it is to get a spot at med school. Undoubtedly, there should be some sort of reward from that, especially when doctors are saving lives on the daily. Having put this much effort into one career, you'd want a comfortable and well respected working environment, when in reality, you're having doctors work long, unsustainable hours with very little pay to compensate that. And also, the lack of job security is another reason that doctors should be allowed to strike. Imagine going through over 7 years of training of a strenuous course to not even be promised a job by the end of it. Doctors need to strike to be recognised for their work and emphasise on the important role they play in our country, therefore be guaranteed job security. To wrap up, there are many reasons why doctors should be allowed to strike, but it all stems from this idea of protecting the public's best interest and maintaining professional integrity. While people may view this as an irresponsible act or think, why are doctors adding on to the crisis that the NHS is already going through, it's crucial to highlight that doctors are promoting the opposite, and undeniably patients themselves want better treatment, shorter waiting times, and the convenience of making an appointment where they won't have to wait more than 6 months. Hence, doctors should be allowed to strike for the good of patients, but also to be awarded for their hard work. Thank you.
So patients are the ultimate victims of healthcare workers' strikes, especially in the UK, because it's a developed country and the NHS is really embedded into the industrial in the industry in the entire year, and a lot of people rely. So doctor strikes are really to the patients, and due to a lack of alternative affordable means of obtaining health care. The rescheduled appointments and longer waits for care. So since the end of 2022, at least 1.7 million appointments have been rescheduled due to strikes by doctors, which this year is going to be the 14th March walk out by junior doctors. And the latest data for July 2025 strike action shows, which was the 13th one that's just recently gone by, shows 54,095 appointments were rescheduled. So that means that patients are going to have to wait longer to have care. Imagine people with severe symptoms are going to have to wait to be able to see doctors that are out on the streets walking out, which is really understandable why they're walking out, but patients are being really affected by the appointment cancellations. Around 66% of reports from a survey conducted by Health Watch said that the cancellations negatively impacted their physical and mental health, which is really dire in today's society and can cause really bad consequences, especially now in today's society. And wait lists continue to rise when they're meant to be falling due to NHS future plans. And the NHS future plan is incorporating a lot of new ideas right now. But if the doctors are like walking out and delaying that progress that is meant to be happening, it's just going to be setting everyone backwards, if you get what I mean. Next slide, please. And then the strains on the NHS. Right now, the flu season arrived unprecedentedly early this year, 1 month before it normally arrives, and has reportedly caused an over 50% increase in the number of cases compared to last year. Around last year, this in a particular week, there were around 245. This year it's like about doubled in the same week, according to a particular research that I saw online. And the NHS is at its busiest season yet, and the strikes are going to put more strain on the NHS as other healthcare workers would have to get into work more, pick extra shifts just to be able to cope with the strain of patients pouring into the wards. So NHS figures also show that there were an average of 1,700 patients in hospital with the flu last week. That was a particular week in November, and early indications from the next week were showing that hospitalizations are continually climbing sharply ever since. So if the doctors are walking out on the streets and there are not enough doctors on site to be able to care for these patients, patient care is delayed, and patients are going to be harmed in that cycle, because the patients would be deprived from the possibly quicker care that they could access if all the doctors were still in doing work. And they shouldn't be striking that as much, because the waiting list would continue to rise and more people would be waiting for NHS treatments. Operations would be cancelled because the doctors that are meant to be on site to do those operations are not there because they're walking out on strikes. So it's really crucial that they reduce the amount of strikes that they do, because patients, the NHS, and so many other factors are going to be affected by these strikes. Yeah, thank you.
So, ethics and public opinion. Having already seen the arguments for and against allowing strikes, it's clear that the underlying concern is about the reduced care and increased risk to the safety of patients. Now, this is a priority for both the public as well as those who are striking, and so the GMC and BMA have both outlined what they want doctors to consider before going on these strikes. And that includes things like the current risk of harm to patients due to the state of the NHS. So that might involve cancellations of appointments or just delays, because those with critical or emergency kind of conditions or states will be prioritized. Those with lesser crucial conditions may not be seen as soon as they would want to be, and waiting lists have been growing since the COVID-19 pandemic anyways. So it's just kind of building on an ongoing problem. But the emphasis is on the fact that these doctors are exercising their right to voice what they want. So they do have that right to go on these strikes, to demand for the changes that will both benefit themselves and in turn benefit the patients. So one of the things that they are striking for is shortages in training positions. And that means that if their demands were to be met, in the future there would be more available consultants and specialist doctors available to treat patients with certain conditions, whereas right now the pressure is on the few staff that kind of remain, while the rest are still looking for those more specialized jobs. In terms of public opinion, as you can see on these graphs, it's kind of going against these strikes now more and more. And it is understandable because, well, this is, as someone mentioned earlier, I think the 13th or 14th strike since 2023. And part of the goals that were set out to be achieved were indeed met last year. So in the past year, I think the average pay of doctors has increased by about 22%. So there's a lot of public outrage about the fact that, well, the needs have been met to some extent. Maybe we should kind of pull back on the number of strikes, especially in these times of crisis, when the priority should be on taking care of these patients. As much as they can sympathize with resident doctors and the NHS, this sympathy is kind of decreasing now because disruptions really. Here, these two graphs kind of show the opinions have changed over time. So since last year, even the number of people opposing has increased and the number of people supporting the strikes has decreased. And then of adults who took the YouGov poll very recently, actually, only 5 days ago, said that they either somewhat or strongly oppose the strikes. So public opinion really is shifting towards not wanting these strikes to be taking place. But in terms of whether the strike should be allowed or not, that goes back to the idea of them exercising their right. But whether they should be doing it at this time, that's more of a matter of nuance, really. So yeah, that's everything I had to say. Next slide, please.
Okay, so I'll be covering some of the example NMI questions that could appear on this topic. There are quite a few examples. I've put about 4 in the PowerPoint, but I think I'll go through 2 and, if time, a third one, and the rest you can read over with some example answers or model answers as well. So the first one, as you can see on this PowerPoint, is reads: Are doctors ethically justified in continuing strikes that disrupt patient care during a healthcare crisis? So firstly, I've sort of got an example mark scheme taken from an interview guide that I have that sort of lays out the sort of way that this sort of question would be marked in an MMI interview. So these are some of the key points that when you're planning an answer to this, you should consider. So an excellent candidate would use above and beyond usual mainstream sources. So this would involve usually presenting ideas that you don't usually see because a lot of people would have the same sort of points for this question, but if you had a few unique points to bring up, that would be good to help you stand out. You're able to articulate your thoughts clearly and succinctly. That's really just about the presentation of your answer, structuring it well also, and being professional in the way that you speak. Then also backing up responses with logical reasons. So this is clearly not just a yes or no question, but logical reasons from both sides of the argument need to be given, and referencing the 4 pillars of medical ethics. And then with any uncertainty, you need to make sure that it's clearly stated. So with these issues, not everything is known at all times, and it should be clear that we don't know all the facts, and we shouldn't act like we do sometimes. So moving on to the next slide. This is a brief table of a brief summary of the sort of arguments you could think about for both sides. Yes, I do acknowledge that on the yes side, it is a bit more, there are a few more reasons I've included just here than on the no side, but we heard quite a few reasons against strikes earlier on. So I won't spend too much time here, as we've heard a few of these reasons already. Although a stat that hasn't been mentioned is this one on the right. It talks about consultants and how the lack of them during strike action actually increases or worsens patient outcomes by about 16% at least. So moving on to the next slide. This is another example question that could be possibly asked about strikes. This one is more about the reasons or your knowledge. It's more testing your knowledge on the current affairs and the context of these strikes, because a lot of what we've discussed so far has been on the issue of pay. And whilst that is definitely one of the major factors, and one could argue the most prominent factor in this debate, there are several other factors that affect the reasons for doctors wanting to strike. So again, won't spend too long on the mark scheme, as it's similar to the last question, but just remember to do all these things. Now moving on to the next slide. So this shows a few of other reasons apart from pay that are, some of the systemic reasons why doctors have chosen to strike. The second biggest one I would say is that top one, lack of career progression, being training bottlenecks. That was spoken about earlier as well. And that there's a stat that there were 80,000 applications in the last cycle for only 10,000 specialty places. These are rounded numbers, so they're not exactly accurate, but if you quote that in your interview, I don't think anyone will pick you up on the exact figures. And some specialties more than others being extremely competitive. I remember this 14-to-1 ratio, I think, is cardiothoracic surgery or something similar. I'm not sure exactly. Yet, however, there's still a shortage of consultants, which just shows the systemic issues in the management of training and the allocation of training posts and how those are managed, because clearly there is a need for this, both for the system and for the doctors who are unable to progress. Other secondary reasons include burnout caused by staff shortages, poor well-being and mental health support for doctors, as they actually have the highest suicide rate, according to the last numbers I read, amongst all the professions in the UK. And at the bottom there, also a lack of respect for the profession, which could come into this arguments about strikes as well, where it comes to the idea of this being a debate in the first place. As if you think about any really other industry, there's never really been a debate about whether strikes should be permitted, as really all workers have a right to industrial action, including strike action. But it's only with doctors where their role is sort of taken for granted that even the idea of them striking becomes a major issue, which is understandable in the ways that it does affect public health and many people's lifestyles. However, looking at it from that perspective sort of shows the lack of respect or reverence had for the medical profession in this country. I'm aware that I'm sort of running out of time with these, so I will just quickly breeze over the last couple of slides for these example questions. So this is another example that could appear. So this is a sort of role play that you could get related to strikes, where really you just have an angry patient complaining about the strikes. As we can see in that poll, clearly a lot of people are opposed to the strikes, so this is not an improbable scenario. And then responding to this patient would really be the same as with any other issue that might arise because of patient frustration with their care. Being able to empathize with the patient, see them things from their point of view, using open questions to encourage them to talk about their concerns, never trivializing the concerns, but really being as understanding as possible, responding to their verbal and non-verbal cues, and remaining compassionate and caring throughout the interaction. Ways of doing this include eye contact and open body language, and expressing your own thoughts coherently when you respond to their concerns. Again, next slide. Mark scheme, and some guidance on those.
Conclusion. Overall, whether junior doctors and consultants should be allowed to strike during times of an NHS crisis is a complex ethical question. Strikes clearly cause short-term disruption and can add pressure to an already struggling system. However, strikes also highlight problems such as underfunding, understaffing, and deteriorating work conditions. Preventing strikes may protect services temporarily, but it does nothing to address the long-term issues driving staff away from the NHS. Therefore, strikes should remain allowed, but with strong safeguards such as guaranteed emergency cover and meaningful attempts at negotiation with NHS staff. This approach balances the immediate needs of patients with the long-term sustainability of the healthcare workforce.